Good morning, everyone. Welcome to session 4 of our nutrition program training. We will give everybody a few moments to keep logging on for those who aren't in yet and get settled before we jump in. So refill your coffee or do whatever you need to do for the next minute or two, and then we'll start. We're glad to see you. Good morning, Ashley. Yes, if you want to say hi in the chat, that would be lovely. Hope everybody had a good Thanksgiving. It's December, which is wild. And just as a reminder, everybody is muted and your cameras are off for this training. All right, people are coming in. That's great. Looks like we've got about 66 here so far. And good morning. Welcome to those who are just coming in. We're going to get started in just a moment. All right, let's go ahead and jump into our Senior Nutrition Program Training Session 4. Today we are going to really focus on program management, the documentation and reporting side of your work with the Senior Nutrition Program. And for those who are joining us for the first time, I'm Julie Sunderman. I work at the Division of Aging within the North Carolina Department of Health and Human Services. I'm the nutrition program consultant, so I oversee the congregate nutrition program and home delivered meals, as well as the senior farmers market nutrition program, and then a few other special projects. I'm so glad to see so many familiar names and some new names too. And I hope that you get a lot out of the training today. It is our 4th session in our series. And originally, this had been intended as the final session. However, we added a 5th session, as I announced last time. There will now be one more happening January 14th. 2026 from 2 to 3:30 p.m. And that is going to be presented by one of the regional environmental health specialists. And the focus of that will be congregate nutrition site inspections. So I know that is a topic of interest to many people. It's optional, as all of these are, but strongly encourage you to attend if you can, and we'll send out that registration link again when we do our follow-up email after today's training. And I know we've gotten some questions about certificates. No certificates have been sent out yet for any of the training sessions. We're still working on that, so don't worry, you haven't missed anything, but those will be coming so that you have those for your records, as we're going to talk about today. It's very important to keep track of that kind of thing. Okay, and then of course, after the session today, we're going to send an evaluation link. We'll also share that at the end. We really encourage you to complete that because it provides really good feedback and information to us about what we can do to make these trainings as helpful to you as possible. We will send today's slides out as well as links that we share throughout the session. And I know that you all are still waiting on slides for session 3. That's on me. I didn't get them to Shania with enough time, so I will make sure you have those too. And then we'll send the registration link for session 5. Okay, and before we jump in, I wanted to just offer a point of clarification because it came to my attention that we have folks here in this training who are receiving HCCBG funding. And then we also have some senior nutrition providers who may not be. And so I just wanted to clarify that the target audience for this training series is congregate and home delivered nutrition providers who do receive HCCBG funding. Everything that we've been talking about is relevant to the requirements of that funding source. So while non-HCCBG funded providers are welcome, and sorry, HCCBG is Home and Community Care Block Grant. So while non-HCCBG funded providers are welcome to be on these trainings, some of this information is not going to apply to you because it is specific to the requirements of that HCCBG funding source. And so just as a friendly reminder to everyone, always follow the requirements of the funding source that you utilize. So if you have a grant from a foundation and they require XYZ, that's what you need to be doing. With the programs that I oversee, the HCCBG funded nutrition programs, I am going over all of the requirements of those programs in these trainings. So I hope that makes sense. You're welcome to answer follow-up questions, or ask follow-up questions. But just wanted to make that clear that everything I'm talking about is relevant to HCCBG funded programs. And as we're going through, please type your questions in the chat. Shania will try to flag those for me, and we'll either answer them as we go or at the end. Okay, so today we're going to kind of talk about monitoring, an overview of what monitoring is all about, what to expect from that process, documents that you need to make sure are organized and ready for review. And then we'll talk a bit about consumer contributions and subcontractor evaluations. So there are certainly more documentation and reporting requirements than just these topics, but we have already talked about many of those things in the previous trainings. So I'll sort of try to highlight those as we go. And again, if you have questions about something that was mentioned, in any of the prior sessions that relates to documentation, reporting, that kind of thing, feel free to ask those as well. So again, we're focusing on program administration, documentation, and reporting, but this training could also have been called forms, or it could have been called if it's not documented, it can happen. So today, again, we're focusing on that paperwork piece, which I know can often feel like a burden, but it is the way that you demonstrate that your program is meeting the requirements and that you are doing all the things that you say you are doing. And so again, that documentation is so key for our program and our funding source. Okay, so like I said, we've already discussed some of the records that you all will be maintaining in your senior nutrition program. We've talked about client registration forms, unit of service records. That refers to the, daily record keeping about meals served to which clients on which day, that sort of thing. Service cost sharing records, that's going to be about consumer contributions. So we'll talk about that today. Having documentation where needed for any therapeutic diets that you may be serving, having documentation of meals prepared, served, and unserved, as well as documentation about the menus that you are using in your programs, and then employment records and training records for your staff. We've kind of already discussed those a bit. And really, a lot of this documentation all comes back to monitoring, the most wonderful time of the year. As I'm sure there are many of us who have been hearing Christmas carols and Christmas songs. And, you know, monitoring can feel really overwhelming, but I think that keeping good records throughout the year helps ensure that when it is time for monitoring, you're ready. And we'll talk a bit about how to do that today. And so I just wanted to kind of show you the layers for our program. So we know that I'll go to our little, you probably remember this, well, maybe you don't, but I shared this in session 1, and this is all about what funding comprises the home and community care block grant. And so again, we have federal funds, local funds, and state funds that are blended into one pot of money that is the home and community care block grant. So when we think about the requirements for the nutrition program, HCCBG funded nutrition program, we are remembering that there are federal requirements, state requirements, and there may be local requirements as well. And so just going back to our layers here, we have the Administration on Community Living, which is our federal agency administering these programs. The funding then flows down to state units on aging, which again is the Division of Aging where I work. Then the funding flows to the area agencies on aging, or AAAs, and then to local service providers, which is who many of you are on this call today. And then you may even do some subcontracting for some of your nutrition program. Perhaps you use a caterer. And so you may have, the funds that you receive from HCCBG may indeed flow then to anybody that you subcontract with for services. So there's all these layers, and at every layer, we need to make sure that those who are receiving the funding are meeting the requirements of the grant. And so that's what monitoring is very focused on. But there are a few other reasons that we monitor as well. So let me just breeze through this and let's talk monitoring. So again, monitoring is all about ensuring compliance with the rules set by the funding agency, but it also helps us think about whether we're doing things the way we had planned them. Is it working out to do XYZ, or do we need to change our approach to something? Are we getting the results that we want? So we know that with HCCBG services, we want to focus on those who are in greatest social need and greatest economic need. So when we monitor, we may be thinking about, okay, is this program reaching the people that it is most intended to reach? And do we need to do something different to avoid problems down the road? So we're kind of thinking about playing it forward in a way. If we continue to do things as we have been doing them, is that going to set us up for success or create some problems? And so we'll be thinking, kind of big picture like that as well. So we do monitoring to identify problems, find solutions early. We also do monitoring to prevent disallowed costs or to detect those and prevent them in the future, or other audit finding, and then to generally just decrease risk and ensure that those who are receiving the funding are acting in line with the requirements. Okay, so in terms of nutrition provider monitoring, this is going to be risk and need based. So your area agency on aging will assess risk for each of their service providers every year, and that's based on a number of factors. And then also they will just do an assessment of need too. They may be aware that there are new staff at your program, and a monitoring visit may be needed to, help those staff understand their responsibilities. Additionally, they may be aware of some issues that have been happening, and so um, that may determine need as well, and that's very much related to risk. Um, and I'll talk about what is going to happen with the monitoring visits generally, but the requirement in addition to risk-based monitoring is that unit verifications for your client eligibility and units served are going to happen at least every other year, but as needed, kind of depending on what is going on with the nutrition provider. And then you, as the provider, also will be a monitor if you subcontract with an entity, for example, a caterer for services, and that will be you completing the subcontractor evaluation form, and we will talk about that at the end of this. And Rachel, the slides will be distributed and they are printable. So basically, when we think about documentation, and especially unit verification specifically, we really want to make sure that your records demonstrate that eligible clients received eligible meals. So tying those two pieces together ensures that all of your units will be able to be verified when you are monitored. So what that looks like for client eligibility is ensuring that the DAS 101 or client registration forms for each of your clients are complete and up to date. And remember that for congregate nutrition clients, those need to be updated annually. And for home delivered meals clients, those need to be updated every 6 months. So your AAA monitor will be checking for that and making sure that they were completed thoroughly and accurately. Additionally, you want to demonstrate that the meals that you served were eligible to be reimbursed through this program. So essentially having that menu certification and any related documents like the nutrient analysis for your menus to show that all the meals met the nutrition requirements, and then having the meal ordering and service records available to show that, on any given day, you ordered enough meals for everyone in attendance and documented all of that correctly. So again, with the unit verification, we want to tie the eligible client to eligible meals in order to be able to verify that unit and say, yes, that was recorded accurately and reported in ARMS correctly. Okay, so before I jump into just a overview of monitoring and what to expect, I'm going to just peek at the chat, and Shania, let me know if anything came up. Okay, I don't think we've gotten any questions yet. All right,
No
so we
questions.
will keep going. Okay, so I'm going to just give you a general overview here of what to expect from a monitoring visit from your AAA. I'm going to say this with the caveat that your AAA will be the best person to inform you about what to expect and what exactly their processes and procedures are going to be. But generally, this is how it works. And for those who have gone through this process, maybe this will resonate. For those who are new, this may be new information. And what I really encourage you to do is reach out to your AAA if you have any questions about what to expect from a monitoring visit, so they can tell you exactly how they run the show. So the AAA every year is going to create their annual monitoring plan, and their monitoring visits for service providers generally occur between September 1st and April 30th of each year. The AAA will contact you if you are going to be reviewed, either a full monitoring visit or only a unit verification, to schedule and confirm at least 30 days ahead of time, so you have advance notice. They will use the nutrition monitoring tool that is created by the Division of Aging to conduct their monitoring visit. And so what they will do is they will review your records, they will conduct staff interviews with your program director or site managers, whoever may be relevant, and they'll let you know ahead of time who they're going to be talking to. And then they're also going to observe. They'll observe at congregate sites and or on home delivered meal routes, depending on what kind of, if you do both or if you just do one. So that is what the visit will this is super high level, but just generally entail. And then before they finish their on-site portion, there will generally be an exit conference or an exit interview where they'll let you know if they discovered any findings with your program, areas of non-compliance. If there are areas of non-compliance, corrective action is required, and that will require follow-up on behalf of you to make those corrections, as well as the AAA to ensure the corrections have been made. And then, once that all is resolved, the review will be closed. A monitoring report will be issued to your agency, and that is that. So again, that's very, very high level, but I hope that's helpful in terms of knowing the general rhythm of a monitoring visit. So I wanted to talk a little bit about technical assistance versus corrective action when the AAA comes to monitor. So you may have heard the term, or I don't know, term is not the right word, TA. If you hear TA, what we mean is technical assistance. And technical assistance is really helpful guidance or suggestions, often strongly encouraged or, very important to enact, but they are related not to any findings of non-compliance, but just areas where your program could be stronger or better. So that the AAA is just such a helpful agency in terms of helping you see things that maybe you're not seeing on the day-to-day basis because you're so in the program. They bring that outside view and can provide those guidance and suggestions to really make our senior nutrition programs across the state as strong as they can be. And then corrective action is different in that corrective action is a required fix to a finding of non-compliance. So if there was any non-compliance found, the AAA would let you know where those areas are and would require that you fix those and demonstrate that you have fixed those within, a certain amount of time, and they'll, depending on what the issue is, it may need to be fixed immediately. If it's a food safety issue, something like that. If it's a documentation issue, the timeline could be a little bit longer for, trying to fix that error. If people are lacking training where they should have been trained, the AAA will help you set, or will set the timeline for you for the corrective action that needs to happen. But it is required that you complete that in order to stay in good standing with the program. And corrective action plans must really address the root cause of the issue and state specifics about solving the problem. So this really depends on what the problem is, but you want to make sure when you're developing your corrective action plan to fix whatever is going wrong, you address who's going to fix it, what exactly is going to be done differently, how this will be fixed, and how it will be sustained over time. So to prevent like backsliding into the same old problem again in the future, how you're going to maintain, if it's relevant, where this corrective action will take place and when, the timeline. Okay, so let's take a quick look at the monitoring tool. I'm gonna stop sharing this way and then share my screen so you can see the monitoring tool. Okay. And Shania, as I am transitioning here, if you want to just let me know if any questions have come up.
No questions right now.
Okay. Okay, great. So you all should be seeing the state fiscal year 2026 Senior Nutrition Program Monitoring Tool. And this year, I updated the tool. So while it looks similar to the tool that those of you with lots of experience with the program are used to, and the content is all the same, the sections have been rearranged a bit with the hope that it streamlines the process for the monitor, and is just a little bit less clunky. And I look forward to hearing from our AAA partners. I know some of you are on the call about, how it goes this year and whether or not it is actually helping. I really hope that it is. But you'll see right here at the beginning, there are 4 different parts to this tool. And the parts are an overview of nutrition services, on-site or en-route observations, site visit related documentation review, and then provider documentation review, which is like those unit verifications. And so we're not going to look at this in a lot of depth, but essentially the AAA monitor will come with this tool and ask you all of these questions and look at all of your documents related to this information and see whether or not you are in compliance with the HCCBG requirements. These questions on this tool are taken directly from our nutrition service standards and what is required in the program. So there is a section on meals and menus. There is a section on food safety and program administration. There is a section on consumer contributions or program income verification. Again, we're going to talk about this in a little bit. A section on fiscal monitoring for just nutrition program, a few congregate only questions, a few home delivered nutrition only questions, and reconciliation of units. This is a section where the AAA will take a test month of meal service records and ensure that they can verify the total number of units by service, reimburse in arms to the total of units of service recorded on your daily tracking sheet. So whether or not you use like Serve Tracker to do that or paper documentation, they're going to want to make sure that what they see in arms and what they see on your meal attendance records and such are matching up. And then here's what they will be looking for with congregate nutrition on-site observations, making sure that activities calendar is posted, making sure the consumer contribution system is in full view, making sure the sanitation permit is posted, those types of things. And then there's, of course, this home delivered meals observation of a route. And this is our site visit related documentation review. So meals ordered versus meals served, approved menus. Do you have all the information needed for that? Meal delivery tickets if you're using a caterer. And then this is all, this is all about documentation for various congregate sites. Lots of questions here. Temperature review for congregate meals and then home delivered meals, and client record review and unit verification. So I'm gonna stop sharing now, and I know that that is just a really basic overview, but I really, if you have questions about what monitoring will look like, please do reach out to your AAA and they will be a great resource to talk through what to expect from their visits. But they will all be using this tool. So this tool ensures that across the state, we are monitoring in a consistent, clear, equitable way. We're asking the same questions of everyone and determining compliance the same way throughout. Okay, let me go back to sharing my slides and we'll keep going. Thank you for your patience. It's telling me that they're still working on it, so hopefully it will come up in a moment. Okay, so let me just go back to where we were. Okay, so we were looking at the monitoring tool. Now we're going to think about consumer contributions. So as you all are likely aware, but maybe not, we have a consumer contributions policy. And the purpose of the consumer contributions policy is to try to extend the availability of in-home and community-based services administered by the Division of Aging through the AAAs, those HCCBG services, to more people by soliciting from recipients of certain services a portion of the cost for those services. So essentially asking people, hey, you receive home delivered meals, you receive congregate meals. Would you like to contribute a bit to the cost of providing that service in hopes that it would enable either our service providers to, let's see. Okay, let me just stop here for a second. Are my slides showing up okay? Are you seeing the consumer contribution slide? Okay. Okay, Melanie, I'm not sure why there's a problem, but it looks like other people are seeing it. So I think just maybe try to refresh or go out and then come back in. So anyways, I lost my train of thought. It's okay. Okay, so I was talking about consumer contributions. Yes, asking people, would they like to voluntarily contribute in order to potentially make the service available to more people? You know, that really depends on the amount of funds that are contributed, the amount of people that contribute, but every little bit helps. And so that is what the consumer contributions policy is about. So the funds that are collected from service recipients are, retained by you, the local provider, and again, either used to increase services to existing clients or to provide services to other people who are in need who aren't yet clients of your programs. So we have consumer contributions policies for home delivered meals, which are a quote unquote type 2 service. This is per the consumer contributions policy and procedure. And what this means is that for home delivered meals, all clients, regardless of income, will be provided the opportunity to voluntarily contribute to the program at initiation of service and then annually thereafter. And this is generally documented. Sharing this opportunity to voluntarily contribute is documented for home delivered meals clients generally with the provider assurance form in each client's file. And I'm going to show you what that looks like in a moment. And then congregate meals are quote unquote a type 3 service. And again, all congregate clients, regardless of income, are to be provided an opportunity to voluntarily contribute. And generally, this takes the form of informing them about this in person and um, a having a posted consumer contributions letter note at the site so that people are reminded of that opportunity. So I'm going to stop sharing this and switch over to that real quick to show you. Okay. All right, so on your screen, you should be seeing the Consumer Contributions Policy and Procedure Manual. And this goes into detail about, everything, anything and everything related to consumer contributions policies. But what I really wanted to show you was the appendices here, where Appendix C is a model letter and Appendix D is the model provider assurance form. So that you can use these if you don't already have a copy. So let me go to Appendix C. And so this is like a model letter that you might use when initiating service or annually from those home delivered meal clients. You might send this, you might have one of your volunteers drop it off with the meals, and you can customize this letter to your agency. And this shows that you are providing the opportunity to contribute to all participants. And then, having this documentation is the way to demonstrate that during monitoring. Then we have the model provider assurance form. And this is how you can, wait a second. Sorry, I think I may have just said this backwards, so I apologize. But the provider assurance form, this can be used to show that you have reached out to each home delivered meals client annually to let them know about the opportunity to contribute, document that here. And so you can, write your agency, what date you contacted them, and who was the person from your agency who did contact them. I've seen a bunch of different ways that this is done. You don't have to use this exact format, but the important thing is that consumers are provided the opportunity to contribute and that is documented so that you know that those annual requirements are being met. Okay, I'm going to stop sharing and go back to the slides. Thank you for your patience as we switch between these different views. Okay. All right. So, just wanted to explain a little bit about consumer contributions and now want to talk about the HCCBG subcontractor performance evaluation. So this is to be completed annually by nutrition service providers who subcontract all or a portion of their HCCBG funded services to either a nonprofit or a for-profit entity. There's a form specific to congregate nutrition. There's a form specific to home delivered nutrition, and providers complete this form sometime between January and June each year and submit it to their AAA. So essentially, the purpose of this is to establish a regular review process so that you can verify that your subcontractors are meeting the terms and conditions of their subcontract. Again, a lot of subcontractors, at least in nutrition, may be catering agencies. So you want to make sure that they're doing what they said they're going to do in terms of the nutritional value of the meals that they are providing you, the food safety and sanitation at their facilities, the, reliability and safety of the food transport. So every year, if you do any subcontracting with nutrition, you will evaluate your subcontractors. So I'm going to go back to, or not back, but I'm going to now switch views again and show you that form so that you have a visual of what it looks like. We'll just do congregate nutrition. Okay, so here's the form. It's a Word document, and as you'll see, you write your agency name at the top. Then you have your nutrition director's signature, as well as the subcontractor agency name. So that might be something like Golden Corral if you are using Golden Corral for your catering. And then the date of evaluation, subcontractor manager on duty. And then there are a bunch of questions here, not a bunch, there are three, three questions here about required assurances. So I'm going to talk about these in a moment because I just wanted to, clarify what these are. But the overall purpose of this section is to ensure that any entity that you all are doing business with, that you all are sharing HCCBG funds with because you're paying them for a service, that they are in line with all of the federal and state requirements for entities receiving state and federal money. So we'll look at that in just a moment. But that's the overall purpose of this section. And then as you scroll down, there are some baseline compliance measures like, is the kitchen a grade A kitchen? You want to make sure they have that health permit the environmental health permit, and that it's a clean, well-run place. There are a couple questions on temperature, menu, transport, and then consumer contributions. The entity may not be responsible for offering consumer contributions. Likely that is going to be you all who do that, so that may be not applicable. But after you answer kind of these baseline compliance questions, you put in some details about the contract scope of work. So let's say that they are supposed to be covering that consumer contributions opportunity and they're not. Noting that that is actually in their scope of work and they're not doing it would be important here. Then finally, there's a few questions on, are they meeting the terms of your subcontract? And did you use the tool to conduct part of your evaluation? If you did, you attach it. Then you turn this into your AAA and they assess the level of risk based on what you found from your evaluation of your subcontractor. Okay. And basically the home delivered nutrition form looks the same. So we won't spend time looking at that now, but these forms are in your e-binder that we shared at the beginning, but I'm going to reshare that because I've added a few things to it at this point. And I think that would be helpful. So let me get back to where we were with our slides. And I am almost finished with the content, so there will be time for questions at the end. Okay. Thank you again for your patience. Okay. Oh, okay. Here we go. So anyways, that first section where the questions are asked about, assuring that this entity is eligible to receive federal or state funds. The Office of State Budget and Management suspension of funding list is connected here. This is what you'll click to answer that first question. We want to make sure that no one who is receiving funds has been disbarred from receiving funds in the state of North Carolina. This is updated every week on the website. So it's pretty much always up to date. And what you would do is, for your subcontractor, go to that link, search for the entity, and make sure that they are not on that list. SAM is the System of Award Management. SAM.gov is the website. This is where anyone who receives any kind of grant funding from the federal government, so that includes all of you, because as we know, HCCBG includes federal funds. This is a registration and tracking system for entities that receive grants. So the subcontractor evaluation form will ask you to ensure that the entity that you are subcontracting with is registered in SAM. Usually that happens with the unique entity ID or the UEI number of that entity, and there's a search function, and you can just check it out. Are they in there? And then the last thing is ensuring that the state grant certification of no overdue tax debts is notarized and on file for that entity. So I'll show you what that looks like. It doesn't have to look exactly like this, but this is a version of it where essentially, they certify that they have no overdue tax debts, and it's certified by a notary, and that should be on file for anyone that you're subcontracting with. And then finally, if the entity is a nonprofit organization, you want to also make sure that they are registered as a 501c3 with the IRS, and you check that by going to this website and looking them up and making sure that they are in the system. Okay. All right, so that is all about the subcontractor evaluation form. Before we open it up to questions, I just wanted to reiterate some key points. The first is document, document, document. Remember that not only are we talking about the forms that we looked at today, but we're talking about documenting staff training, client eligibility, menus, liquid nutrition, supplement, therapeutic diets, if that's applicable to your program, documenting temperatures and other food safety issues as well. And just overall being as organized, clear, and careful as you can. So if you have staff that are, if you have staff at different nutrition sites that are keeping records in different ways, perhaps one person is using a check mark to note when somebody is there, and another person is using, a check mark and let's say the letter A if they're absent. What I really recommend is you come up with a standardized way you want things done and you train your staff on that way so that everybody's doing it the same way and there's no room for misinterpretation because you don't exactly know what the system is. So you want just a really clear system that does not leave room for interpretation. You want it to be very black and white. Was this person present or was this person absent? Just as a one example. So being organized, being clear about what your expectations are regarding documentation, and being careful, making sure that, any handwritten things are legible, making sure the ink is dark enough, stuff like that actually really matters when it comes time to having an outsider look at your records and try to interpret those. It's always great to have two sets of eyes on things as well. So building in that double check is a great part of your process, would be a great part of a process and procedure. And then finally, just being proactive generally and asking questions when you're unsure. I think this group is great at that. And it can really help kind of get ahead of the problem on the front end and deal with any issues before they snowball and become something bigger, and thus harder to deal with and potentially more financially impactful as well. So asking questions of your AAA, they are in touch with me as well with questions that come up from time to time, and I'm always happy to weigh in. I do a lot of learning that way about, what's going on and how to interpret certain things. So I love the questions, and I know that your AAAs are happy to provide that assistance as well. So with that, that is the concluding slide for our presentation today. If you scan that QR code, it will bring you right to the evaluation for the session today. We would love to hear your feedback. I know that there's just so much we could talk about every time, so I try my best to figure out what are the key points. But if you can think of something I missed that you would love training on, please put that in the evaluation. That is partly how that is partly why we're having that 5th session with environmental health, because I got such good feedback on the training from Angie Pinion that I asked her if she could come back because people were so excited about it. So we really do take your comments seriously and love to hear your feedback. And yeah, we are scheduled until 10 this morning. So if you have questions, please ask away. Justin says, can we print the AAA monitoring tool? Yes, of course, Justin. That should be in your e-binder. But again, I'm going to send that e-binder out again, so I will double check and make sure. Shania has put a registration link for session 5. I hope you'll join us in January. And yeah, when will the slides be available? Lisa, I am hoping to get you the slides this week. Maybe even today. That would be great. But yeah, I just have to basically format them and put my little email together, so it shouldn't take too long. So hopefully this week. But yeah, if you feel like you've gotten what you need today, feel free to log off. Thank you so much for your time. I appreciated everybody being here. But if you have questions, we are all ears for the next few minutes. Thanks everybody for coming. Really appreciate it. And thank you for the work you do every day. So, so great. Oh, okay. So Jennifer has a question. Can you talk briefly about the requirement for site inspections? So Jennifer, let me ask you this. Are you talking about subcontractor evaluations, or are you talking about AAA's monitoring providers? Oh, I see what you're saying. Okay. Post-COVID, some of it changed. Okay. Yes. So yeah, I think during COVID, um, the congregate sites were not being inspected by environmental health. I think that's what you're talking about. Jennifer, I'm thinking, I'm wondering if maybe we can unmute you somehow. Let me see. If you want to just say your question, because I think I'm do. All right, let me see if I can. Okay, Jennifer. I'm gonna allow your mic. I don't know if you can unmute yourself and you want to ask a question, but I think I'm just like oh, okay. Oh, okay. Okay, so you are talking about the health inspection. Okay. Yes. So yeah, there's I would say what we have clarified, and we meaning Division of Aging with the environmental health specialists, is that because of the way our nutrition service standards rules are written, that all congregate sites do need to be inspected by environmental health. There was a little bit of uncertainty about that, given that some sites were serving like completely ready to eat meals and doing no food prep on site. So some environmental health specialists were like, well, how can we inspect if there's nothing to inspect, sort of. But again, we revisited the rules, and the way they are written requires a permit from environmental health for all congregate sites. So that information, and I'm still trying to get some information on this myself, but it's my understanding that that is how environmental health is approaching it. However, whether or not that has trickled down to every single health inspector in every single area is a bit unknown right now for me, at least, and I'm trying to figure that out. But what am I trying to say here? The Yeah. Um, so yeah, bottom line is your congregate site does need to have a health inspection. And so okay, that answered your question. Okay, fabulous. I hope that was helpful for others as well. And yeah, I think that the training in January will be super helpful with this as well, because Angie she is better at talking about it than I am. I will say that. Um, were they the facility? In the facility. Okay. Yeah, so yeah, I think what Amber is saying in the chat is that, not only do health inspections look at kitchen facilities, but they also look at plumbing issues like the bathrooms, the place that they're eating lunch. They make sure that staff have adequate training on, sanitation procedures and what to do in case of like vomit and diarrhea and like that kind of stuff. So even if no food prep is happening at your congregate site, there are still a lot of food safety measures and kind of infectious disease prevention measures or containment measures that we want to be practicing to minimize the risk of illness that results from, being at the congregate site. So even though that food prep isn't happening, we still want that environmental health perspective to ensure that our sites are as safe as possible. You're welcome, Jennifer. Great question. Okay, anything else? I know it's 10:01.
Someone asked that the nutrition coordinator needs to be ServSafe certified. I don't know if you saw that one.
The nutrition coordinator. Okay, well, it kind of depends. If nutrition coordinator is the director of your nutrition program, then yes. But if the nutrition program or if the nutrition coordinator is more like a site manager, then they need to be trained in food safety, but not necessarily ServSafe certified. It kind of just depends on what that person's role is. We do require that training for directors of nutrition programs. Yeah, so Carolyn, that was what we were just talking about with what if food is not prepared on site. So even though food may not be being prepared on site, there are other factors about a congregate site that could that could contribute to illness, foodborne or otherwise. And so environmental health comes and inspects not just the kitchen, but the dining facility, the bathrooms, plumbing, hand washing sinks, that kind of stuff that, and they issue a permit based on those areas as well. So, um, so yeah, even though food is not being prepared on site, there is still a place and an importance on having that environmental health inspection to keep people safe. You're welcome. Okay, everybody. I'm going to end the event. Thank you so much for being here today. Thank you for your questions. And we will hopefully see you in January. Okay, bye.